If you take a look on his right wrist, you know, take this bone is much longer than this bone, and they should be about the same length.
Oh, so this thing right here had to be taken care of, right?
So this one is now shortened. In our office, we always say, half jokingly, that the two most difficult types of patients to treat are the pro athletes and the 8 to 14-year-old child with a very involved parent. Most of the injuries that we see from pediatric sports injuries are acute trauma, fractures, ligament injuries, but the overuse injuries that, as an upper extremity surgeon, that we see are pediatric Little League elbow syndrome and gymnast wrist. And both of these injuries deal with kids injuring the same part of their body, whether it's the gymnast that's vaulting and tumbling and constantly loading their wrist, therefore causing damage to their growth plate, or the pitcher who's pitching too many games and is injuring the inside of his elbow, much like a pro pitcher would. Parents of high-level kids that are functioning in all these different leagues, generally between 8 and 14 years old, it's quite difficult. They're not fully healed yet, and the parents want them back for the playoffs. And it's a hard conversation to tell them that we want your son to be perfect for the rest of his life. It's not about these 2 more games. What are these 2 additional games going to do? There's a big risk reward there, so that becomes frustrating.
I didn't know anybody when I was growing up who burned out when they were 12 or 13.
Right.
That's a relatively new phenomenon, and it's